This video is for all the professionals working on the profile of registered nurses and registered psychiatric nurses and are willing to migrate to or work in Canada. It will provide you an in-depth knowledge about the National Occupational Classification Code of Registered Nurses and Registered Psychiatric Nurses. So, let's start the video.
Hi, I am Smith and welcome to our channel A2Z Immigration Updates. We make informational and latest news videos regarding global immigration. Watch this video till the end and don't forget to subscribe and click the bell icon, so that you can get the most updated immigration news and information. In Canada, every skill profile has a unique code that is called National Occupational Classification Code or NOC Code. This code tells us about the detailed information associated with a profile and regarding the key parameters like profile description or profile lead statements, key responsibility area and main job duties, employment requirements, alternative and illustrative job titles in exclusion. So, first of all, let's see the NOC code and its description for the profile of this video.
The National Occupation Classification Code or NOC code for the profile of registered nurses and registered psychiatric nurses is 3012. As per Statistics Canada, the profile description of registered nurses and registered psychiatric nurses is as follows. This unit group includes registered nurses, registered psychiatric nurses, and graduates of a nursing program who are awaiting registration, graduate nurses. They provide direct nursing care to patients, deliver health education programs, and provide consultative services regarding issues relevant to the practice of nursing. They are employed in a variety of settings including hospitals, nursing homes, extended care facilities, rehabilitation centers, doctors' offices, clinics, community agencies, companies, private homes, and public and private organizations, or they may be self-employed.
Key responsibility area. Human Resources and Skill Development Canada has defined a proper set of job roles for every NOC code. There is not any fixed guideline for meeting all the requirements. As per the recommendation of experts, a person should meet at least 50% of the job responsibilities mentioned in the NOC code. Now let's discuss the key job responsibilities associated with your profile. So, here we go.
Main job duties of unregistered nurses and registered psychiatric nurses are as follows. Assess patients to identify appropriate nursing interventions. Collaborate with members of an interdisciplinary health team to plan, implement, coordinate, and evaluate patient care in consultation with patients and their families. Administer medications and treatments as prescribed by a physician or according to established policies and protocols. Monitor, assess, address, document and report symptoms and changes in patients' conditions. Operate or monitor medical apparatus or equipment. Assist in surgery and other medical procedures. May supervise licensed practical nurses and other nursing staff. May develop and implement discharge planning process on admission of patients. May teach and counsel patients and their families on health-related issues in collaboration with other health care providers. Registered nurses may specialize in areas such as surgery, obstetrics care, psychiatric care, critical care, pediatrics, geriatrics, community health, occupational health, emergency care, rehabilitation, or oncology. Occupational health nurses develop and implement employee health education programs and provide registered nursing care in private businesses and industry. Community health nurses provide health education and registered nursing care in public health units and through home visits, manage complex home care cases, participate in community needs assessment and program development, conduct disease screening and deliver immunization programs. Psychiatric nurses provide nursing care, supportive counseling, and life skills programming to patients in psychiatric hospitals, mental health clinics, long-term care facilities, and community-based settings. Nursing consultants provide consultative services to institutes, associations and health care organizations regarding issues and concerns relevant to the nursing profession and nursing practice. Nursing researchers engaged in research activities related to nursing are self-employed or are employed by hospitals, public and private organizations and governments. Clinical nurses provide leadership, advice, and counsel on the provision of research-based care for specific patient groups within the care of particular healthcare organizations.
Employment requirements and other additional information. In this section, we will discuss the employment requirements for your profile. Every job has a specific set of employment requirements associated with it. The main employment requirements factors includes 1. Type and level of formal education. 2. Specific training or apprenticeship. 3. Experience in the same or other related occupations. 4. Licenses, certification and registration to practice in a regulated profession, extra. Before moving further, let's understand the employment eligibility requirements and other additional information associated with your profile.
Following are employment requirements for the profile of registered nurses and registered psychiatric nurses. Registered nurses. Completion of a university, college, or other approved registered nursing program is required. Additional academic training or experience is required to specialize in a specific area of nursing. A master's or doctoral degree in nursing is usually required for clinical nurse specialists, clinical nurses, nursing consultants and nursing researchers. Registration with a regulatory body is required in all provinces and territories. Registered psychiatric nurses. Completion of a university or college registered psychiatric nursing program is required. Registration with a regulatory body is required in Manitoba, Saskatchewan, Alberta, British Columbia, and the Yukon.
Every job role or employment can have multiple profile titles. So if you are not able to find the exact job title for your profile, then you need not to worry. Now we will see the list of illustrative and alternative titles for your profile. This section is a list of titles commonly used in the labor market. We will also see the exclusions list, that is the list of titles that cannot be covered under your profile. So let's have a glimpse of it.
Illustrative titles for the profile of registered nurses and registered psychiatric nurses are as follows: Clinical nurse, Community health nurse, Critical care nurse, Emergency care nurse. The list is quite large, so, if you want to read all the alternative profile titles, then you can pause this video and can have a proper glimpse. Now let's see the exclusion list. Nurse practitioners, C-3124 Allied primary health practitioners. Nursing coordinators and supervisors, C-3011 Nursing coordinators and supervisors. Nursing service managers, C-0311 Managers in health care. Registered practical nurses, C-3233 Licensed practical nurses. So, this was all about the profile of registered nurses and registered psychiatric nurses with NOC Code 3012.
We at Brain Drain Consultants Private Limited helps you to migrate to Canada on work permit or on PR. Our motive is to convert your immigration dreams into reality. We assist you in Canadian-style resume and cover letter preparation, mapping the best employment opportunities with your skill set, employment consultation and job search, online skill profile preparation and branding, education credential assessment filing Canada, migration skill assessment filing Australia, expression of interest EUI filing, LMIA, work visa, PR, business visa filing. If you need any further information, then you can contact our team of expert registered migration and employment consultants. Our team will help you to explore the employment, work visa and other immigration opportunities for your profile in Canada and Australia. Click on the booking link mentioned in the description to reserve an expert session for a detailed discussion to explore your immigration opportunities. We also assist employers to file LMIA with Employment and Social Development Canada (ESDC). So if you are an employer in Canada, we can help you to get the best manpower for your company. Canadian immigration is a merit-based immigration process, and your selection under most of the immigration programs depends upon your age, Education,
experience,
English language capability,
spouses' educations and experience,
employment availability through LMIA.
provincial nomination extra.
We at Brain Drain Consultants Private Limited provide a one-stop online platform with all kind of immigration services for our global customers.
You can have online
Consultancy sessions, assessment application filing and all kind of visa processing assistance by our team of experts.
If you want to do a self-assessment and check your eligibility for immigration,
Then click on the link attached in the description and download our app to do your immigration assessment yourself. Also watch our other videos related to work visa filing and finding a job in Canada from your home country.
So, if you like our video, then don't forget to subscribe,
Like and share our YouTube channel. Also hit the bell icon to get the most updated information regarding global immigration. Thanks, and we will meet again with one another informative video soon.